Hello everyone. So today I'm going to talk about falls, which means that what you are going to do when a patient present with a history of fall. Okay. So in this video, we are going to discuss how to take the history here, how to rule out differentials, what are the differentials here, what are the red flags that you need to rule out, and how do you examine this patient and how do you provide management. Okay. So whenever a patient presents with any kind of symptom, the first question that we ask in the history is, can you please tell me a bit more about it? Okay, so kind of an open question. So whenever a patient presents with a history of fall, he tells you that I fell at home, I fell at work, I fell on the roadside, etc. So the first question should be, can you please tell me a little bit more about it? Okay. The next question should be, did anybody witness the fall? So in case of fall, this is also a very important question, and you will come to know why in the next few minutes. Okay. So the next question should be, did anybody witness this fall? Then, as you previously know, I have discussed in the previous videos that whenever a patient presents with any kind of pain, any pain in any part of the body, the history should be Socrates, okay? That is site, onset, character, radiation, aggravating and relieving factor. If the patient have any other symptom apart from the pain, we ask Odipara, that is onset, duration, intensity, progression, aggravating and relieving factors. But here, you can neither fit Socrates or Odipara because fall is not a symptom. Okay, fall is not similar to pain or nausea or vomiting. It's not a symptom. It's an event. Okay, so falling is an event. It's not a symptom. So we are going to take an event type of history. That is what happened before this event, what happened during this event, and what happened after this event. Okay. So in before, you will ask about how were you feeling before the fall? Okay. Were you feeling unwell recently? If unwell, what were the symptoms that you were experiencing? Were you experiencing any heart racing or sweating? Okay. And when was your last meal? These two questions, heart racing and sweating, they occur in hypoglycemia. And if the patient tells you that the last meal was, for example, 12 hours ago, 8 hours ago, then you may think about hypoglycemia. Also, heart racing before the fall, it can occur in arrhythmias. Okay, so you will ask, how were you feeling before the fall? Were you unwell recently? If you were unwell, what were the symptoms that you were experiencing? Did you experience any heart racing or sweating? And when was your last meal before the fall? During the fall. So what happened during the fall? The first question that we will ask, did you lose consciousness? Okay. So when you fell down, did you lose consciousness? This is important because if the patient lost consciousness during the fall, then he cannot answer the rest of the questions that happened during the fall. So this is where the importance of the witness come. Okay. If somebody has lost consciousness during the fall, then the rest of the question, the fall witness will answer. Okay. So we will ask, did you experience any head injury when you fell down? Did you hit your head? Okay. Any jerky body movements? So if the patient, for example, lost consciousness, then we will ask, okay, so did anybody witness the fall? What did they tell you? Were there any jerky body movements? Was there any tongue bite? Did you wet yourself? So these three symptoms, that is jerky movements of the body, tongue bite, wetting means urinary incontinence or stool incontinence. These three will occur in a fit, okay, either epileptic fit or fit due to any other cause, but these three will means that the patient has experienced a fit, a seizure, okay. So these three questions are for seizure. This question is to know whether the patient has experienced any head injury during the fall or not, because this is also very important to know whether the patient has experienced any head injury, and if so, what was the extent of injury, okay. Now, after the fall, so after the fall, we will ask the patient, how were you feeling after the fall? Were you sleepy or were you alert? Did you vomit? And did you experience any other fit? Vomiting and fit are also very important. So, for example, the patient has had a head injury during the fall and he is vomiting afterwards, or if he is experiencing seizures afterward, then this means that the patient has experienced bleeding inside the subdural space, that is subdural, epidural or subdural hemorrhage. Okay, so it will warrant a CT scan. I will discuss the head injury in further detail in a separate video as well, but just to give you some pointers here, that is as to why we are asking these questions. Okay. All right, so you have taken an event type of history, that is before, during, and after. So this has covered pretty much everything, but still you will ask the patient, is there anything else that you would like to add on this? Is there anything else that you would like to tell me? Okay. Now, what are the differential diagnoses of fall? So there are, like, you can classify it into two main types. Number one is accidental fall, which we have all experienced, okay, the accidental falls. And number second is medical reason of the fall. So accidental fall can occur due to any reason like slipping, if there is wet floor or loose carpet or something. It can occur because of poor lighting at night time. And it can be because if the patient is under the influence of alcohol, he is more likely to fall. So these three, they don't have any medical reason to them. They are purely accidental. Okay. And the next thing is medical. So first of all, you will rule out the accidental causes. You will ask about the lightning at the time, or there any loose floor, loose carpet, sorry, wet floor, etc. So you, and were you did you take alcohol before the fall? Okay. So these are the accidental causes. Now the medical causes, the first thing that you will ask in the medical, okay, sorry about that. So medical causes. The first question in the medical causes after ruling out the accidental causes is the loss of consciousness, because medical causes we can divide into with loss of consciousness and without loss of consciousness. So for example, you ask the patient, did you experience any loss of consciousness? And he says yes. Then we have these five differentials. Okay, so we have five differential if the patient lose consciousness. And we have main two types of differential if the patient does not lose consciousness with fall. Okay, so for example, with loss of consciousness, it can be because of hypoglycemia. Okay, so a diabetic patient who has taken insulin but has not taken any meal for a long time. Okay, so hypoglycemia. Then postural hypotension. Postural hypotension means that the blood pressure falls when the patient stands up, and when he stands up, there is a sudden fall in the blood pressure and he falls to the ground. Okay, so postural hypotension. Then cardiac causes, so arrhythmias and heart block. Okay, then epilepsy, which is basically seizures, and then vasovagal syncope. So vasovagal syncope is kind of when a person sees an unpleasant sight, okay, or unpleasant smell, and all of a sudden he drops to the ground. This is called as vasovagal syncope. All right. So these causes, if you look at them, these causes that present with loss of consciousness, they're more of a general type. So hypoglycemia is involving the whole body, postural hypotension, blood pressure involves the whole body, then cardiac causes, epilepsy, and vasovagal syncope. Causes without loss of consciousness are more specific. They are either because of the ear problem, the ENT problem, or the CNS causes. Okay. So without loss of consciousness is without loss of consciousness is main two types, ENT and CNS. In ENT, you have BPPV, okay, benign paroxysmal positional vertigo, where the patient turns head and he all of a sudden experience vertigo and falls to the ground. Meniere's disease, where there is hearing loss, episodic hearing loss, episodic vertigo, and fullness in the ear. They also fall to the ground without loss of consciousness. Vestibular neuritis, which is kind of a viral inflammation of the vestibular nerve, where the patient experiences vertigo and he falls down. So ear causes are three: BPPV, Meniere's, and vestibular neuritis. Then CNS causes stroke and TIA. Okay, patient can fall down during stroke and TIA as well. Acoustic neuroma, which is a CNS tumor. Okay, so acoustic neuroma, it's basically the eighth nerve tumor. Cerebellopontine angle tumor, it's also called cerebellopontine angle tumor. Here, the patient can also experience falls. And then multiple sclerosis, which is a demyelinating disorder involving the CNS. Okay, so without loss of consciousness is ear and CNS. With loss of consciousness, you have five differentials, which are more of a general type, like hypoglycemia, postural hypotension, cardiac problems, epilepsy, and vasovagal syncope. So this was your history of presenting illness. Okay, as you can see that stroke and TIA is also a cause of fall. So when you ask before and after questions, when you are asking before and after questions here, let me show you. All right, so if you are asking before and after questions, you will also add any weakness in any part of the body here, okay? Sleepiness, vomiting, any fit, and any weakness in any part of the body. Because if the fall is because of the stroke, the patient will have weakness in, like, permanent weakness in a specific part of body, like any leg or any arm or face muscles after the fall, okay? After this, your history of presenting illness is complete and you will ask about past history. So in past history, you will ask about any falls previously, okay, previous falls. And if there were previous falls, were they similar to this fall? And if yes, how were they managed? Okay, and then medical conditions. So these medical conditions that predispose to falls, you will ask, like diabetes mellitus, high blood pressure, heart disease, and ear problem. So usually patient with high blood pressure who are taking more than one blood pressure medication and they are also elderly, they are prone to postural hypotension. So this is a very important question, that do you have high blood pressure and are you taking medications for it, and how many medications, and are you taking them regularly? Okay, the next part of the history is Meftosa, asking about, are you on any medications at all, any allergies? Um, you can ask family history of cardiac problem, etc. And psychosocial, okay, who do you live with? Are you able to manage your daily activities? Um, are you working? What do you do for a job? Is it affecting your job, etc.? And then lifestyle questions, that is smoking, alcohol, food, exercise, etc. After that, you will ask about eyes, that is, do you have any idea of what might be the cause of your symptom? Any specific thing that you are concerned about? Any specific thing that you were expecting from us today? Okay. After that, you will go to the examination part. So in examination, you will check three things. Number one, vitals. Vitals means that is heart rate, temperature, blood pressure, and oxygen saturation. Blood pressure here, in cases of fall, you will check blood pressure both on lying down and in standing. Okay, both on lying down and in standing. So normally the difference in the lying and standing blood pressure should be less than 20 millimeter of mercury systolic and less than 10 millimeter of mercury diastolic. Okay, if it is more than that, then it means that this patient has postural hypotension. Okay, so BP on lying down and on standing. You will examine the chest to listen to heart sounds and lung sounds for cardiovascular causes, and you will also do a neurological examination for stroke, TIA, acoustic neuroma. And after head injury, you need to do neurological examination anyway. If the patient is presented with fall and head injury, you need to do neurological examination to find out if there is any weakness in any part of the body. All right. Now, management, I will explain generally how to manage a fall patient, and then for each differential diagnosis, I will make a separate video and I will explain the management for all the differential diagnosis in specific. This management is only a general management just to give you a clue of how we proceed with a fall patient. So, because fall is kind of a serious thing, we are, depending upon the cause, we are either going to admit or we are going to observe for a few hours, okay, in the emergency department. So, either admit or observe depending upon the cause. Then we will inform seniors. We will order some investigations. These are quite a bit general investigations. Depending upon the specific cause, you will aid on further investigations as well. So routine blood tests, that is CBC, LFTs, RFTs, urea and electrolyte, ECG tracing of the heart to look for arrhythmias, and CT brain if required. For example, if the patient has hit his head during the fall, or if there is weakness in any part of the body, then you will order CT brain. Okay. I will make a separate video on head injury cases and we will discuss a specific criteria of ordering a CT brain in cases of head injury. And if you are suspecting stroke, then for stroke patient, for every suspected stroke patient, we order a CT brain. Okay. Then symptomatic treatment. For example, if the patient is experiencing headache, or any pain, if he has injured any specific part of the body during fall, then we will give painkiller. If he's feeling nausea, we will give antiemetic, etc. And specific treatment depending upon the cause of the fall. Then we will safety net, and then we will also arrange follow-up. So this was the general management of fall. And I hope this video was useful. I'll see you in the next video where I will discuss the detailed management of each of the differential diagnoses of falls.